Yeah, hi, my name is Eric Johnson. I'm the Vice President of Marketing at Harmony Healthcare IT. We are a data software company that performs data migration, data archiving. Been in business since 2008. Have customers primarily in the U.S., but we do have some international presence, 500 customers plus, and we've handled over 550 different types of clinical systems.
Yeah, amazing. Thanks, Eric. And so the work you do for those 500 and something customers, it sounds like particularly in healthcare specifically, what's the kind of work that you do with those clinical systems?
Yeah, absolutely. So primary focus is really focusing on the problem of managing legacy data, right? So
It's got a lot of that in healthcare too.
Absolutely. So, the use cases there, right, is that, the amount of data that is accumulating in healthcare is just continuing to amass, right? So therefore, if you look at the average health system in the United States in particular, but, even globally, they're managing hundreds of disparate systems, perhaps even up to something like 10, 20 different kinds of EHRs. So you've got all this data that's sitting out there, right? Some of it's being used, some of it's not. That's posing different types of security risks. There's data retention requirements for all this data in terms of patients, record release needs in the U.S., right? And so what we're going to come in and do is actually take all of that data, consolidate it down into one instance, and put it into some different kind of storage, right? So it could be cold storage, could be something known as warm storage, or even actually what we do a lot of is active storage, which it means that now that you've unified all of this data, if there's a patient record that's available, inside, let's just say, an Epic EHR, we can alert a clinician to let them know that there's legacy data there. So then you actually unify this information together, it saves a tremendous amount of legacy costs, right? So you're paying for all those systems and to maintain that and might not even be using the full functionality, posing a tremendous security risk for that data that's certainly sitting out there, right? And then, of course, there's the records release impact of that. If you've got patient records that are divided across multiple locations, how do you unify that? And so that's primarily what we focus on in terms of managing the complete data life cycle from really beginning to end.
I can imagine that I'm well aware of many clinics and hospitals where, like over the continuum of time, there's systems they've migrated from, but they've held on to them just because we're going to archive those old records here. And then there's the manila folders in the back, and then there's the hard drive under the desk in Dr. So-and-so's office.
Right.
And as you say, yes, it's messy, but also there's a risk there too for like on the cybersecurity side, but also just generally the ability and the responsibility you have from a clinic or a healthcare system's point of view to be able to then share back information and make those insights. So it sounds like too that there's a bit of the combination of both a platform play, like the technology ability to pull everything together, but I guess you need that expertise within healthcare too to really know what you can do and can't do. And I imagine there are CTO, CIOs, clinic owners that kind of need, they've got a lot on their plate generally to be able to understand every little bit of nuance. They know they've got to do a lot of stuff in relation to data, but you kind of want to work with people who do this for a living, right?
100%, right? And there's a lot they can do in-house, and they do, of course, right?
Sure.
But all of a sudden becomes a pretty complex challenge. And do you have a strategy, right?
Yeah.
So is there a strategy in place for managing legacy data as they are moving towards something in the future, right? Hence why a company like ours can come in and help them with that strategy. Combination of services actually do the work. Software actually then help manage that data, and the combination of those two things then gives them the capability to do that in an effective way. One of our customers actually presented this week, a customer called Parkview Health, during HIMSS, and really what he talked about primarily was a lot about the greater strategy, especially when you're using a shared instance in more of a rural environment, right? So, now how do you do that, right? And because all the health systems were certainly faced with cost pressures, right?
Yep.
Delivering care, and these are areas operationally where there can be a tremendous amount of savings, but it might take somebody with that level of expertise to come in and help them understand that.
Yeah,
right?
absolutely, absolutely. And that's a good example to be able to hear about, like, say, well, as you say, what Parkview Health did, and I'm sure there was a lot of insights there for that session. Generally, because you also touched on too that, once you've got all the information together, then you can do something meaningful with it. Right. What is the things that clinics and health systems are really looking to do once they've got all that information together?
Yeah, well, and I'll make a transition to another announcement here in a second.
Okay.
But yeah, ultimately now, you've got this information that is accessible, it's secure, right? And maintainable in a way that is going to be compliant, right? It's not sexy, but it's essential.
Depends who you ask, I guess, but
right. Yeah, right.
Everyone's got their thing, but
for really strategic institutions, what you might say, right, is this becomes the proving ground then for unifying data, right?
Yeah.
An enabler then to be able to start to take on more sophisticated applications, particularly those applications, right, that are going to need to require and delve into a data set that's much more homogeneous, right, to leverage AI technology, right? So,
right.
At the end of the day, AI is only as good as the data that it's operating against. And so therefore, how do you get to a point where you can use large language models, right, against a data set that is looking at information, of course, that isn't disparate.
Yeah.
Right? And
you got to at least have it in the one spot to be able to then interrogate.
So for the real strategic institutions where they can be able to do that and keep that in mind, I think that that is where then they could possibly have a real advantage, right?
Sure.
And in terms of using this in a strategic way.
Yeah, and strategically, I'm sure those benefits can vary in terms of just purely efficiency and cost saving, but also on the patient engagement and retention side and the services that are provided, and also the clinician engagement as well. So there's multifaceted. Hey, you touched on that there's a couple of announcements that you're making at HIMSS, and there was another you were going to talk about. Walk me through some of those.
Yeah, absolutely. So talk a little bit about so far managing legacy data. And for Harmony, we actually have launched in much more of the active data side, and we are introducing a product here at HIMSS called Clearway, which is for registry management. So now we move into much more of the clinical side of a hospital. And so today, this week we've announced this product, which is an AI-powered registry management product. And what that does, particularly focusing in today for Epic customers in cardiology, is we are able to then implement our tools that will help a clinician much more rapidly perform the data abstraction process out of a clinical chart and submission process for a clinical registry, which number one is highly complex. So you're talking about any number one of a registry that might have something in upwards of 900 or 1,000 different fields, right, that a nurse abstractor is going to have to go through and fairly manually leveraging multiple different types of applications or spreadsheets to find these data elements and then put them in the right format, right?
Sure.
And so what's not complex about a registry is really the sense of just simply, well, here are the fields, now go get the data, put it in the fields, and then submit it, right?
Yeah.
But the process for how that happens is complex and requires a lot of resources traditionally to do that. And it's a burden on that staff in the hospital.
Yeah.
So we have the opportunity to be able to solve this problem through technology, which has the ability, using AI and natural language processing in our tools, to be able to automate that. Our own time studies have shown that we've been able to reduce the amount of abstraction time almost up to 80%. So per case, right? So you're talking about, down to, if something that took roughly 45 minutes, we can get it down 80% lower that per case.
Yeah, well.
Now, I think what's important to understand about this too, especially with this process, and I think it's why so far our early adopters are seeing success in this. And when we talk about this to prospective customers, is that, one thing that's important about AI is ensuring that you build a tool set that a clinician can trust, right?
Yes.
They can understand and really see how is the problem being solved through your algorithm? And then before they have to make a decision, there is a way to provide some sort of governance to a decision process. And we do that for our tool set. So what I'm not saying is it doesn't require a clinician to still complete a process, but we can dramatically reduce the amount of hours that it takes to do this and increase the accuracy of that submission.
Yeah.
So therefore, we can put it right in the back of the hands of a skilled nurse abstractor to then just complete the process, but understand and make choices through really our governance tool set.
Yeah.
And so it's really actually a fairly classical use case of AI models, right? Where this isn't black box technology, right? Where AI models fail, we're putting this out in the hands of a clinician to be able to make a better decision and find anomalies so we can make sure that the abstraction process is accurate and then faster.
Yeah.
So,
yeah, look, I mean, definitely the efficiency side of things and the accuracy are all super important things that we need in healthcare in implementing some of these innovative technologies, particularly AI. Lastly, then, if I was to ask you, Eric, if there was like one or two kind of key bits of advice or information or things to think about for attendees here at HIMSS, or even just the CIOs, CTOs, decision makers within the healthcare systems that are looking to implement artificial intelligence or make sense of all of their disparate data. They know they've got to do something about it, but like perhaps it is an overwhelming or it's a big beast to take on. Like what's your key one or two things to start with to really get the ball rolling with that?
yeah, absolutely. Well, first and foremost, what I would say is, if you're looking for solutions, obviously for data archiving, data migration, and not sure necessarily about, how you would approach that, we're here to help, right? And help determine what that strategy might look like and give you that roadmap, so that, in the time, in these times where you're really looking to save money, these are areas of opportunity where you can really come in and leverage tool sets and services around managing legacy data, right? That it's a real opportunity there. When we transition over to registry management and using these AI tools, right? This is something new, right?
Yeah.
And so therefore we're really actually just taking the opportunity to try to get the message out with this new product. To that point, we actually just announced this publication this past week.
Yeah.
And this is a HIMSS publication. So this is the Healthcare Innovation Series, Voices of Innovation of AI, published through HIMSS. This is our booklet that actually features the use case around Clearway. And this is published by Ed Marks. And so who's a notable CIO today. And so I would say read this, that number one, our use case, but not only that, this is an excellent guide really for any institution. Was created, as Ed would tell you, to be able to really be a guided book of almost 30 plus types of different kinds of use cases of AI.
Yeah.
Not only in the US, but also internationally. So it's really intended that somebody could pick this up and then actually go do this.
Yeah.
Right. So, pretty cool article.
Yeah.